Hospitals throughout the country have been suffering, and it's contributing to the primary care crisis. The New Jersey Healthcare Quality Institute held a summit on May 11th of this year that discussed the trials and tribulations of patients using an emergency room as their primary care office due to a lack of choices.
ERs are horrible places to be. I mean, there aren't a whole lot of people that like to sit in the emergency room for 6 hours, in the city of Camden. I mean, they're frightening places to be, and they're not, places I think people want to be. If they had a better choice, they'd use it.
Dr. Jeff Brenner, who works for the Camden Coalition of Healthcare Providers, says that's just the tip of the iceberg.
No one gets healthier or happier or more well-being or more longevity by going to the emergency room. Acute problems get solved, but people don't live longer, they don't live more joyful, happy, successful lives because they're going to the emergency room over and over. You're not fundamentally altering their well-being and their lifestyle by having them go to the emergency room. They're not getting patient education, they're not getting prevention, they're not reframing the issues that they're facing in their life.
In fact, it can cost the patient and the healthcare provider more money when an ER is used.
There are insurance policies that will not pay if you go to the ER if you could have gone to a primary care physician or an urgent center. And I think that's valid. Why should my insurance policy pay hundreds of dollars for my son who cut his chin on a playground and needed a few stitches? You understand when that could have been done just as safely in some less intense setting.
The cost is certainly an incredible problem. Last year, the Washington Post quoted the New Jersey Hospital Association, which said 77 hospitals provided $1.3 billion in charity care, but only got back $716 million from the Garden State. It goes on to say that in the past 15 years, hospitals have had to absorb $6 billion in losses on charity care cases. Dr. Brenner is hoping to save primary health care by recouping that money and helping those who go to the ER frequently outside of the hospital.
Our high utilizers, within about 3 to 6 months of going out and seeing them, building relationships with them, treating their depression, treating their chronic illnesses, helping them find housing, helping them get Medicaid, long-term disability, just stop going to the ER. They don't want to keep going. Once you begin to meet their needs, the whole drive to go to the emergency room evaporates. So it's not rocket science. I mean, it's not really, that difficult to do, but it's a matter of putting the right people in the right room together with the right incentives and asking them to cooperate. And the way we build healthcare, that doesn't happen very often, but it doesn't mean it can't happen more often.